French Bulldogs are one of the most loved breeds in the world. But behind that adorable face is a reality many people never see: breathing issues, spinal disease, skin infections, surgeries, and lifelong medical care. At Rocky Mountain French Bulldog Rescue, we take the dogs with nowhere else to go. You see the cute face, the snort, the personality. What you don't see, what it takes to give them a second chance. Let us show you what that really looks like. Welcome to Medical Monday. Today we will be focusing on brachycephalic obstructive airway syndrome, or for short BOAS. BOAS is an airway obstruction caused by narrow nostrils and a long, soft palate. This is Riggs. Riggs is an adorable Frenchie that has BOAS. Riggs can experience airway inflammation that can trigger respiratory distress. Poor Riggs. BOAS is common in Frenchies because they have flat faces, which means compressed airways. Ways to diagnose BOAS include noisy breathing, exercise intolerance, and by a vet exam. Always see a vet if concerned. The best way to prevent BOAS is early evaluation. Treatment options include surgery for the nares, palate, oxygen, in emergencies, and weight control. This condition kills Frenchies every year in Denver because they overheat. This is why rescue matters, because these dogs don't just need homes, they need medical support. Welcome to Medical Monday. Today we will be focusing on intervertebral disc disease, or IVDD. IVDD is a spinal disc rupture that can cause pain and paralysis. This is Hazel. Hazel is paralyzed in her rear legs and gets around with the help of a cart and drag bag. Despite this and her ongoing care needs, she has an incredibly sweet personality. Hazel's story highlights the challenges many dogs face with these conditions, just like Dora, who inspired RMFBR. This is common in Frenchies due to a mix of genetics and a compact spine. Ways to diagnose include pain, wobbling, dragging legs, and an MRI. Ways to prevent IVDD include no jumping, harness use, and maintaining muscle and weight. Treatment options are strict rest, meds, and emergency surgery with rehab. Welcome to Medical Monday. Today we'll be focusing on hemivertebrae/butterfly verts. Hemivertebrae, butterfly verts are misshapen vertebrae. Here are some x-rays of a spine with this condition. This is Dora. Dora's hemivertebrae shaped many parts of her life, but they never defined her spirit. She faced each day with determination and joy. Dora's legacy lives on through every dog RMFBR supports. Frenchies are especially susceptible to hemivertebrae, butterfly verts because of breed-linked spinal malformations. The best way to diagnose is through X-rays. These are often incidental unless there are neurological signs. Always see a vet if concerned. The best form of prevention for this condition is responsible breeding. Treatment includes just monitoring in mild cases, and surgery and mobility support in severe. Welcome to Medical Monday. Today we'll be focusing on heat stroke. Heat stroke is when the body overheats, which is an organ failure risk. All dogs are susceptible to heat stroke. That's why it can be so dangerous. Please be careful this summer and remember to keep your pup cool. Frenchies are especially susceptible to heat stroke because they can't cool effectively due to BOAS. Signs of heat stroke include panting, collapse, and vomiting. If vomiting, seek emergency veterinary care. Always see a vet if concerned. Ways to prevent this include no heat, no midday walks, and AC always. When treating heat stroke, it involves immediate cooling and emergency care if needed. This might include fluids and oxygen. Welcome to Medical Monday. Today we'll be focusing on gastrointestinal issues, specifically regurgitation. Chronic regurgitation causes food or water to repeatedly come back up, often alongside reflux and a sensitive GI tract. It can be caused by several factors including an elongated palate. Meet Nappy. He is available for adoption. Nappy can experience regurgitation, just like any other dog. Though, Frenchies are more susceptible. It is especially dangerous for them as it can cause aspiration pneumonia, which can be fatal. Frenchies are especially susceptible due to their anatomy and food sensitivities. Ways to diagnose include history, an X-ray, and a scope if severe. Always see a vet if concerned. Ways to prevent this include elevated feeding, small meals, and a proper diet. Treatment involves a diet change, meds, and potentially managing it lifelong. Welcome to Medical Monday. Today we'll be focusing on hiatal hernia. A hiatal hernia is part of the stomach that slips into the chest through the diaphragm, causing regurgitation and reflux. Meet Butter. Butter has suffered from a hiatal hernia, which is made worse by BOAS. It causes him to regurgitate food and water, and can also lead to aspiration pneumonia. Here is an X-ray of Butter's hiatal hernia. Frenchies are especially susceptible because of brachycephalic pressure from BOAS and congenital weakness in the diaphragm. Ways to diagnose include chronic regurgitation, gagging, or weight gain, which should lead to an X-ray, and a fluoroscopy or endoscopy. Ways to prevent this can include managing airway issues early, feeding small meals, keeping calm after eating, and maintaining a healthy weight. Treatment includes meds and lifestyle changes for mild cases, and in severe cases, surgery. Welcome to Medical Monday. Today we'll be focusing on skin issues, specifically allergic dermatitis and Demodex. These skin issues cause itching, infections, and hair loss. Meet Nappy. Nappy has some lasting skin changes from past issues, like a bald belly and some scar tissue, but he doesn't let it slow him down. He's an adventurous Frenchie, who is available for adoption. Frenchies are especially susceptible to these types of skin issues because of a weak skin barrier and immune quirks. Ways to diagnose include a skin scrape, cytology, and allergy testing. Always see a vet if concerned. Ways to prevent this can include a quality diet, routine skincare, and early treatment. Treatment includes allergy meds, medicated baths, and mite treatment. Welcome to Medical Monday. Today we'll be focusing on ear infections. Ear infections are chronic yeast and bacterial infections. Meet Coco. Coco had to get TECA, total ear canal ablation surgery, which gave him a second chance. After years of painful ear infections, he's now pain-free, hearing better than expected, and loving life again. The surgery cost $5,153.76. TECA is not cheap. Frenchies are especially susceptible to ear infections due to their narrow ear canals and allergies. Ways to diagnose include odor, redness, discharge, and an ear cytology. Always see a vet if concerned. Ways to prevent ear infections include routine cleaning and managing allergies. Treatment includes med drops, cleaning, long-term allergy control or TECA. Welcome to Medical Monday. Today we'll be focusing on cherry eye and corneal ulcers. Cherry eye and corneal ulcers are prolapsed tear glands and eye injuries. Meet Bruno. Like some dogs with severe cherry eye complications, Bruno developed chronic dry that nearly cost him his right eye. A specialized surgery rerouted his salivary ducts to his tear ducts, helping save his eye. Bruno recently passed away, but he left this world deeply loved and cared for. Rest easy. Frenchies tend to be especially susceptible due to their large, exposed eyes. Ways to diagnose include a visible red mass or squinting, which should lead to a vet exam, stain. Ways to prevent this include avoiding any potential trauma and monitoring irritation early. Treatment for cherry eye is surgery, and for ulcers, it's meds or emergency surgery. Welcome to Medical Monday. Today we'll be focusing on chemodectoma. Chemodectoma is heart-based tumors affecting blood flow. This is Captain and Bosley. Captain and Bosley were diagnosed with chemodectoma, a silent tumor that often goes unnoticed. Captain sadly lost his battle with chemodectoma, but his legacy lives on through his contribution to research. Today, Bosley is still making memories with his family, offering hope for dogs diagnosed with chemodectoma. Frenchies are especially susceptible because brachycephalic breeds are predisposed. The best way to diagnose chemodectoma is through an ultrasound or echo. Always see a vet if concerned. There are no ways of prevention as it is genetically linked. Treatment options include monitoring, managing symptoms, and sometimes surgery or radiation. This is Welcome to Medical Monday. Today we'll be focusing on joints, specifically patellar luxation and hip dysplasia. This is joint instability which leads to pain and arthritis. Meet Riley. Like many French Bulldogs, Riley has faced his share of joint challenges. With patience, care, and consistency, he's grown stronger and more confident every day and is now able to enjoy short walks. Frenchies are especially susceptible because of their compact structures and genetics. The best way to diagnose patellar luxation and hip dysplasia is through any limping, skipping gait, or a vet exam, X-ray. Always see a vet if concerned. Some ways of prevention include weight control, muscle strength, and avoiding overstrain. Treatment options include supplements, meds, and surgery depending on the severity. This is the reality of the breed. Not one issue, but many, often all at once. And behind every diagnosis is a dog who needs someone to say yes. That's why we exist, to take the cases others can't, fund the care they desperately need, and give them the second chance they deserve. It's not simple, it's not cheap, but it's worth it, every single time. Now you see what it takes to save a French Bulldog. And you can be part of their story. Every dollar, every share, every yes, can change whether they get that chance at all.